Hello and welcome. My name is Niklas Warmbold. I'm co-founder of the company Intensovet. I'm medical engineer and we developed the Intensobox to help veterinarians to take care of intensive care patients. In this video, we are going to talk about the technical features of the Intensobox, and we are going to talk to Dr. René Dörfelt, intensive care specialist from the University of Munich, and we're going to talk about some normal indications where the Intensobox or oxygen cages are relevant, and we are going to talk about how to treat patients in the oxygen cage best. In the past few years, we had a lot of questions from customers how to use the Intensobox best. This is why we have the emergency and critical care expert, Dr. René Dörfelt, here today, who is going to answer some questions. Welcome. Thank you.
In our clinic, the most common indication for oxygen therapy with the Intensobox is respiratory distress, dyspnea, and especially cats, if they have congestive heart failure, they come as an emergency and they get into the oxygen cage pretty soon. And other indications for oxygen therapy are other respiratory causes as feline asthma, as post-anesthetic oxygen support, especially in these breeds, brachycephalic breeds like this dog. Post-anesthetic oxygen support is very helpful. Some other indications are severe anemia. If the patient is here with a hematocrit of, let's say, 10–12%, it's helpful to give oxygen to the patient. And additional indications are shock. Patients in shock suffer from cellular hypoxemia, and there it's absolutely helpful to give oxygen to the patient. Monitoring of dyspneic patients is not really easy. The first thing is the clinical monitoring we do. So we look at the respiratory rate, respiratory effort, and as soon as respiratory rate and respiratory effort decrease, it's likely that the patient is not that hypoxic anymore, but it's just a subjective parameter. What we have to take care about is not just to look at respiratory rate, because some patients decrease in respiratory rate if they worsen with the respiratory distress, as they require much more respiratory effort. Therefore, I think it's important to watch respiratory rate and respiratory effort. The other thing is we could use some monitoring, apparative monitoring as pulse oximeters. And as most of you know, pulse oximetry in dyspneic patients, it's not really easy to place it at the tongue or somewhere. So we especially use a reflecting pulse oximeter probe as shown here. So here's the pulse oximeter going through the inlet of the Intensorbox. If we place the pulse oximeter probe at the tail of the patient, we usually get a pretty reliable signal and get a pretty reliable oxygen saturation reading at the machine. This, as the question suggests, depends on the indication. So if we have a patient which is severe dyspneic, we place the patient in the cage and increase the inspiratory oxygen to 60, 70 or even 80%. And this for a few minutes, and try to reduce it as soon as possible to down to 60, 50, 40%. So most patients require 40% inspiratory oxygen concentration, and depending on the severity, we increase or decrease the oxygen content. The good thing on the Intensorbox is that it has the ability to control oxygen concentration in the cage, and does this automatically. So if we choose the oxygen concentration of 40%, the oxygen cage fills the oxygen if required. And therefore we don't need too much oxygen flow, especially if you use very cheap oxygen, just doors or cheap oxygen boxes. You require higher oxygen flows with 10, 12, 20 liters per minute. So your oxygen bottle is empty in a few hours. And the Intensorbox kind of preserves the oxygen because it's also pretty close and oxygen cannot really escape. For other indications, as post-anesthetic oxygen therapy, it's usually okay to have about 30 to 40% inspiratory oxygen content, as for this little guy here. And then if we try to wean the patient from oxygen, we try to reduce the oxygen concentration by 5% every 10 to 20 minutes and watch the patient, how is it developing, and if the respiratory rate, respiratory effort is still okay, does not increase, we can decrease further and further down to 25%. And if the patient is okay with 25% inspiratory oxygen, we can just remove it from the oxygen cage. This very much depends on the patient. So if the patient is just dyspneic, we usually don't warm the patient, but the Intensorbox has the chance to warm the patient with the heating pads in the ground floor, and has also the option to control the temperature in the environment, in the air in the box. And if the patient is very hypothermic, especially cats with dyspnea, cats in shock, we try to warm them to increase the body temperature to about 37 degrees Celsius. We choose a ground temperature, floor temperature of about 40 to 42 degrees Celsius, and try to choose a air or environment temperature of about 20 to 24 degrees Celsius. It's very important not to increase the temperature too much, especially in dyspneic patients, because a very warm environment can contain very much humidity, and humidity decreases temperature regulation of the patient. I think these are very important tools in this Intensorbox. If the patient sits in the box, especially this little dog, and if this dog is panting, very much warm and humidity is produced and accumulates in the box. Also, the humidity is removed from the box because if the patient gets too humid, the temperature regulation of the patient is very much decreased, and we know this from dogs, especially during heat stroke and so. And also the CO2 removal is absolutely important because the cage is pretty close, and if the patient sits in there, it produces CO2 in his environment, and this leads to, or increasing CO2 leads to respiratory acidosis. Patient gets more acidic, and in very severe cases this could lead to CO2 narcosis or CO2 anesthesia. And here in the box, the soda lime included here removes the CO2 from the patient. The box has also the option to measure the CO2, and if the CO2 is too high, it gives an alarm, and then it's time to change the soda lime. As mentioned before, I think it's important not to warm the patient too much in order not to increase humidity and discomfort for the patient. And what I think is also very important, not to open the cage too often, because if you open the cage, all the oxygen which is in the cage goes outside, and the oxygen concentration in the cage decreases down to environment oxygen concentration of 21%. So it's important to keep in mind that this happens, and if we want to remove the patient or do something at the patient, we should coordinate us and our staff as good as possible, aiming that the cage door is closed as long as possible, because oxygen removes from the cage, it needs to be refilled, and this requires very much oxygen flow. Another thing which is important is to look at the patient's oxygen concentration. Because if we remove the patient from the box, which had about 40% inspiratory oxygen concentration, to environment air, where is about 21% oxygen concentration, and the patient is still dyspneic, and then it may become hypoxic in a very short time, in just 1, 2, or 3 minutes, and then the patient is at risk of dying. So especially if we want to take some blood samples or go out for a walk to urinate with the patient, it's important to care about oxygenation of the patient. So maybe place an oxygen mask in front of the patient, use flow by oxygen, or place a nasal oxygen tube and go with the oxygen bottle for a walk with the dog. Important not to stress the animals during that period. What is very nice in the Intensoboxes is that they have these little doors in the doors which can be opened, and then you can do some things that the patient can inject some drugs or replace the monitoring or something else without opening the whole door. So the oxygen concentration stays in the cage and does not go out. I've been working with oxygen cages or oxygen boxes since, I think, 10, 15 years at least. So different cages, and I think it is the best box I ever worked with, because the concept is very well thought. There are many parameters to control. You can set the oxygen concentration, you have the CO2 control, you have some light, and so on. So it's a well thought concept. What is also pretty nice is the use of the box is pretty easy and self-explanatory. The cage is pretty quiet if it works, and I've worked with some other cages which were pretty loud during the fill-in process with oxygen or during the cooling process. So it's one of the boxes with less noise production. What's also nice is it's pretty easy to clean. The surfaces are pretty easy, pretty flat surfaces, and in the little holes at the doors you can push in some fluid lines or monitoring cables or whatever you want to use. Another important point from the management point of view is, I think, the documentation of the oxygen which was required for the patient. So you can read up how much oxygen was used during the last hours or days for the patient and invoice the owner for this. So I think it's also a very important thing.
I hope we could provide all relevant informations about the Intensobox and about the use of oxygen cages themselves. We are happy to hear from you and answer all your questions.